Okay, good evening, folks. Welcome to our first COVID update. We'll give a few minutes for a few more people to join us. I'd ask that you please stay in mute during the first part of the session, and there is a chat box if you have questions and you want to ask questions. I'd ask you to type in the questions in the chat box, because if we turn mics on, it's just you're going to voice over everyone else, and that'll be very distracting. Just get started here in a few minutes. Okay, for those who don't know me, I'm JP Saleeby. I'm a functional medicine physician. I have two practice locations, one in Murrells Inlet, which is near Myrtle Beach, and the other in Mount Pleasant near Charleston, South Carolina. We also have a virtual presence in North Carolina. I am associated with another practice, the Functional Medicine Center up in Durham. And we have on staff currently 5 nurse practitioners and PAs, and a staff of 2 registered nurses and an MA that service our patients. I recently joined the FLCCC Alliance, and as a consequence of that, we had a posting to help folks with what to do if you want to prevent COVID and maybe are or are not vaccinated, what the protocols are, as well as what to do if you get exposed or if you get COVID. So this is a great website. I encourage you all to basically bookmark this and visit it frequently, because it is a type of website that's open to not only practitioners and clinicians and researchers, but also for patients. These protocols are based on research, heavily researched and referenced, and fairly frequently updated. Matter of fact, the outpatient eye mask protocol for prevention and early outpatient protocol was just actually updated last night. They have a webinar every Wednesday evening. I was on that webinar last night, and Dr. Corey and a couple of other clinicians were making presentations and came up with some new and exciting things to add to their protocol. So that went up late last night and is up today. The iMath protocol is actually hospital treatment protocols, and the iRecover is a protocol for long haulers or long COVID and post-COVID syndromes. And that can include post-vaccine syndromes, which we're starting to see. Now, these are clinicians that are considered mainstream. Not very many of them, I don't think, are necessarily functional medicine or integrative, but they tend to lean towards that with some of their recommendations. I particularly get a little bit more aggressive when it comes to some of the nutraceuticals, and we'll spend a little time talking about the current iMask Plus protocol, which is for the outpatient and inpatient, early outpatient and preventive. So for prevention protocol, they're still using number 1, ivermectin, which is an antiparasitic drug. It's been around for a long time. It was used to treat children and adults with river blindness in Africa and in South America. So it's been FDA approved for treatment in humans, probably long before it was used in animals. There's a lot of noise on mainstream media about ivermectin being for horses and animals only, and it is available in veterinary powder form and topicals. I do not encourage patients to use those for human use. There are USP human use ivermectin that compounders can compound in capsules, or you can be had readily available in 3 milligram tablets. Obviously, it's more cost effective if it's compounded, because the protocols are typically weight based, anywhere from 0.2 to 0.6 milligrams per kilogram body weight, depending on the severity of illness and what we're trying to achieve as far as prevention or early treatment. They're advocating in prevention some ivermectin, which we'll be taking twice weekly. It went from once a week to twice a week fairly recently after August the 11th, and now that's being held at twice a week. Vitamin D3, vitamin C, quercetin, and zinc are part of the nutraceutical, basic nutraceutical bundle. We get a little bit more aggressive with this, and I'll kind of go over that with you. And also the early treatment protocol, again, this was just updated last night for the consideration of the Delta variant. Ivermectin is still on here, although it's becoming more rare and scarce to get. Pharmacies are just running out. Their resources for where they can get the human powder for human consumption are limited, and so there's some back orders. Nitrosoxanide is another agent. We'll discuss that and how that's available. I'm very familiar with this drug. I've actually used nitrosoxanide or Alenia for several years in some of my Lyme patients. It has antiviral properties, and that's been known for years. And it's a pretty safe drug with a low side effect profile. We'll talk about some of these things as well. Fluvoxamine, which is also called Luvox, is an antidepressant. It's a SSRI family drug, and it has come through some of the engines that they use, or algorithms that they use, to look at hundreds and thousands of drugs that are out there on the market that are FDA approved, to see if they fit certain receptors and work against COVID virus. And this is one that did hit the radar and has been used and has been in clinical trials with some success. And this helps, especially with the psychiatric or neurological manifestations. But in and of itself, this particular drug does stop the replication of the COVID-2, the SARS-CoV-2 virus. And then, of course, there's the monoclonal antibody therapy that has to be done at an infusion center or an emergency room. These agents, these monoclonal antibody agents, are extremely expensive, and they are reported in the literature as working, whereas in some cases, IV remdesivir doesn't seem to take a dent out of those that are ill. Aspirin therapy should be used for anyone with blood clotting history disorder, and it's for those that are sick, not for prevention so much, but if you're ill with COVID, then you should be on aspirin therapy to prevent clots. And again, the D, C, quercetin, and zinc. So let me talk a little bit about the prevention. So we had started fulfilling prescriptions for people who wanted ivermectin for prevention, to prevent them from getting COVID to begin with. And that was fine and dandy up until several days ago, when the pharmacies were reporting shortages and inability to fulfill these prescriptions. So one pharmacy I had to use was out in Wichita, Kansas, for example. So none of the local pharmacies were able to fulfill this. And that's a problem that we kind of anticipated. Nitrosoxanide Alenia is a drug manufactured by Romark Pharmacy. It's usually fairly expensive in the brand name form. Typically, it's FDA approved for the treatment of infectious diarrhea for a 3-day course. So you take one pill twice a day for 3 days. Those 6 pills will cost you $800. So you can imagine what a 10-day or 20-day course of this medication would cost. It's a little bit cost prohibitive. But we are able to, because I use this drug a lot in my Lyme patients, because it has activity against Lyme bugs and co-infections. We have a relationship with some particular pharmacies where they cap out the cost at $300. So with your insurance, if your insurance pays $200, you only have to pay $100. If it doesn't pay anything, the most you would pay on a nitrosoxanide prescription would be $300. Now, a few months ago, it came off patent. So now it's generic. It's available generic with the price is not that much less expensive than the brand name, unfortunately. But if you go through this particular pharmacy, the price is much, much less. And I'm using this in Lyme patients for 30, 60 days. So a 30-day prescription would typically be at a regular pharmacy about $8,000 for 1 month. Obviously, it's nicer when you can only have to pay $300. A couple of things about this drug: it's pretty safe with a low side effect profile. It does turn your urine, tears, sweat, a kind of a fluorescent yellow-green color. We encourage people not to wear their contact lenses because it will stain their contact lenses. And in very high doses, when you get up to 2 grams, it's normally given 500 milligrams twice a day. So that's 1,000 milligrams daily. But once you exceed the 2,000 milligram dose, it can actually stain the sclera, the whites of your eyes, yellow. And that can be misconceived as, liver problems, jaundice, and it's not jaundice. As soon as you stop taking it, that yellowness will resolve. So it is encouraged to take this with meals. Same with ivermectin. You should not take it on an empty stomach with food. It helps absorption. Okay. The dosing schedules, again, will change. You notice that for prevention, it's 0.2 milligrams per kilogram body weight. For treatment, depending on the severity of the disease at the time you initiate it, you should go with 0.6 milligrams per kilogram. And you take that basically daily, not twice a week, but daily, anywhere from 5 days to 10 or until recovered. And then you have to determine if there are other measures you need to take. So the other things that they've added is this, like I said, the fluvoxamine or Luvox, again, been around, generic, so it's not that expensive. 50 milligrams twice a day for 10 days. That helps with some of the neurological and psychiatric components, but it also is an anti-viral properties in that it stops replication. One of the researchers from Brazil on the webinar last night was reporting that men tend to be more susceptible than women. There are more men that are vented and more bald men with higher levels of testosterone or DHT. So they theorize that maybe anti-androgen therapy, so drugs that shut down production of testosterone, might be helpful. And lutetiazide and spironolactone are 2 such drugs that can be used for a short period of time. And I would encourage men on bioidentical hormone replacement therapy, if you're taking testosterone and you start getting sick with COVID or you suspect it's COVID, stop using your testosterone therapy. Now, if you have pellets or injectable, well, you're kind of a little bit out of luck. But if you're using the topical cream, transdermal creams, you can just stop taking the creams for the total time it takes to get over COVID. I'm not big into monoclonal antibody therapy. I think it's really expensive and we're not even really sure it works. But if you have access and the money involved, the thousands of dollars it takes per infusion, and that has to be done at an infusion center. And it's always a good idea, if you can tolerate aspirin, to be on aspirin therapy. Now I'm going to switch over to the iRecover protocol. This is for long haulers, and this is for folks that have post-COVID syndromes. And this is when we first started seeing this fluvoxamine drug was first introduced in this protocol here. And then if there's pulmonary issues, you do some special pulmonary toilet as well as corticosteroid therapy or steroid. These are like prednisone tapers. And then there are other things involved, like the use of mast cell stabilizers, because this can lead on to mast cell activation syndrome. So there are a couple of drugs and things like that that can be used. Singulair, which is montelukast, low dose naltrexone, but that's not going to work right away. Some of my patients who are on LDN have the benefit of having a ramped up immune system and protection with LDN, but this may take weeks to even months to get up to therapeutic dosages. So this is kind of short, but this is for long haulers, people who might be facing therapy requirements for weeks to months. And then there's omega-3 fatty acids, which is like your fish oils. Atorvastatin is for inflammation. They're not doing this to change lipids around, but some of the statins have anti-inflammatory properties. I'm not a big statin fan because it depletes CoQ10 and can interfere with mitochondrial function. So that's one that I probably won't use in my patients. Melatonin, if you can tolerate it, you start with low dose. Start with 1 or 2 or 3 milligrams and then work your way on up to 10. Now, melatonin can be had in long-acting or sustained release 3 milligram tablets. So start with 3. If you tolerate it, go to 6, go to 9. You only take melatonin at night. Never take it in the midday or in the morning. That's just bad form, and it has been shown if you do it out of sequence, in other words, if you take melatonin in the morning, you will increase your cancer risk. Melatonin in high doses is used as an anti-cancer therapy, but only at nighttime dosing. Our vitamin D levels, and there was some talk about the different forms of vitamin D. There are D2, D3, and their metabolites. And I think they were kind of splitting hairs last night in discussing different forms of D. If you're a poor absorber, add higher doses of vitamin D and add some vitamin K2 to that for increased absorption. And take it with food, take it in the evening. And our requirements are much higher than this. We're recommending 5,000 IU up to 10,000 IU. And then if people are really sick, we sometimes put them on 20,000 IU, international units per day, of vitamin D3 with K2 for a period of time until we are assured they have a serum level greater than 60 nanograms per ml. So it's important. It's not necessarily the dose that you're taking. So some people can achieve a very high serum dose, blood level, with 3,000 or 4,000 IU. Some people require 10 or 20,000. So it's important to have these blood levels checked. Okay, I'm going to flip through. So I'm listed on this website, as are many other doctors, according to state. We have a new landing page now, just totally dedicated for viral infections, influenza, COVID, and others. We are asking people not to call the office because our phone systems have exploded and our regular patients can't even get in to talk to us. We ask you please to use the email, and the email is right here. So if you have any questions or comments or concerns, please email us. Don't call the office. We have your ability to use full script. If you click on this icon, you will we will be notified, and you will automatically get a complimentary list of all the nutraceuticals in the bundle and the appropriate doses and supporting information. And that's all comes to you complimentary from us as a public service to the patients in the area. And also it comes with a 10% discount if you order your supplements through that. There are links here that you can use to create your intake form and waivers. And for group sessions, we will probably have group sessions in the future where people can actually discuss their health concerns. So it's confidential. You have to sign one of these waivers to participate in those. And you can also register here for educational and supporting material. Let me go to the calendar and open this up here. The nitrosoxanide or Alenia is definitely been studied. I've got a Lancet report here that was published this year that shows its effectiveness against placebo in treating folks with early and mild to moderate forms of COVID infections. And this was done at 500 milligrams 4 times a day for 14 days. Now, this was a study out of Egypt. They were experimenting with doses anywhere from 500 twice a day to 3 times a day. Dr. Zelenko and Dr. Horowitz were using Alenia back in, I think, December, and they were using it 3 times a day. So the studies here in Egypt, which are being published now, are more aggressive dosing. We also talked about adding fluvoxamine, which is Luvox, and also anti-androgen therapy. That just became part of the protocol yesterday. And again, I'd be leery to do that unless somebody has, again, I would test their testosterone and DHT. And if it's high, then I would use anti-androgen therapy. But it's only for a short period of time, 10 days. Aspirin is part of the bundle, and the nutraceutical bundle. And I said ours is a little bit more aggressive. And if you wish to know what those are, certainly reach out to us by email, and we'll provide you that via Fullscript. But essentially, it's higher doses of vitamin D3 or D2. They were talking about calcitriol and calcifediol. Those are different forms of vitamin D. Some believed to be better absorbed than others, but I think they're kind of splitting hairs about that. And what really matters is serum levels. So you want to definitely look at getting your vitamin D levels checked. Other things that you would want to get checked, so that was a good idea, are things like CRP, C-reactive protein, D-dimer, things like interleukin 6. So these are biomarkers that can help us determine how bad your infection is and how we need to proceed, how aggressive we need to be. So things like CRP, D-dimer, and interleukin 6 or IL-6. Again, you need a clinician to be able to do that. Dr. Brownstein, who's known as a thyroid doctor with his studies in higher doses of iodine, was on the A4M website webinar last night as well. And he's advocating the use of higher doses of iodine. So Lugol solution, you can do that as a mouth rinse, or you can just ingest higher doses of iodine because we know iodine helps with as an antimicrobial, antiviral. So you have to be careful if you have Hashimoto's, because you don't want to go into a Hashimoto flare. Again, you need someone to help guide you with iodine. You just can't go gobble up huge doses of iodine. So just be careful with that one. And let's see, I want to take us off of the screen share here. And I will open it up for questions now. If you don't mind typing in the questions in the chat box, because if you come off of mute, very likely what will happen is we'll be just talking over each other. So if you don't mind just typing in questions, there's something at the very bottom here of your Zoom field that says chat. It's a chat box. So if you open that up, it'll open up to the right and you can put questions in there. Okay. So I don't have any questions yet. Phoebe, you're waving at me. You want to come off? You can come off mute if you want. We don't have too many folks in the room, so you can come. Let me see if you know how to do that.
Okay.
Oh, there you go.
Okay. So do you want me to finish? I was typing it, but I wanted you to know I was doing a question.
Sure.
Want me to just type it or ask you?
No, you can ask, as long as we're not 10 people talking at the same time. So go ahead.
Okay. Well, I was wondering, like, if you have a patient who is not who should not be vaccinated because of their medical conditions, is that something that you are comfortable writing a statement about so someone can be exempt from having to get the vaccination?
Yeah, we have to be very careful about letters we write, whether it's wearing masks or vaccinations. I really don't want to talk about vaccinations tonight. I want to limit it to a discussion on early outpatient treatment and prevention.
Okay.
But we're very limited in what we can write. Some people are losing their jobs if they don't get vaccinated. And some people do have legitimate reasons. Some people have just personal preference. And we have to be able to support a letter to defer vaccine or with legitimate medical diagnostics, because we have to be able to support that, let's say, in court. So we're really not doing a lot of those letters. So the FLCCC website recommendations, we go over and beyond that, because sometimes we use things like NAC. I see a question here that asks if we're using NAC or N-acetylcysteine, and that is a great supplement. It's a natural amino acid. It is great for hollow organ infections. So hollow organs like sinus, lungs, bladder, intestines. So we know that COVID can also cause GI gastrointestinal problems. So NAC and acetylcysteine in higher doses, usually 500 to 600 milligram capsules, can be taken 3 times or even 4 times a day until symptoms resolve. So yes, and that also helps you make glutathione in your liver. So there's couple of benefits of that. We also use liposomal glutathione. It usually comes in a bottle with a pump, and you pump it under your tongue. Two pumps, 2 to 4 times a day is what's indicated. That is very helpful with neurological symptoms and cardiovascular symptoms of COVID, like the myocarditis. It supports mitochondrial function, and glutathione is one of the strongest antioxidants that we produce. We produce it in the liver, but sometimes your body needs a little help. The powder, the capsules, and pills are not very stable. They degrade quickly. The very, very best way to get glutathione is IV as a solitary push, but you have to go to like an infusion center to get that. So the next best thing is the liposomal. Okay. And sometimes that's part of our protocol too. So let me see what, let's see, I can't read some of these questions. There's small type. There's a question about the Delta variant. Okay, I'm not sure I understand the question about that. Let me see. Let me go to the next question. Oh, somebody said the first time they took Alinea, it was rough on the stomach. Yeah, one of the side effects of Alinea is a little GI upset. And of course, the color changes to the urine and the sclera and the tears and the sweat. But it could also be a fact of herxing. So some people have a hidden tick-borne illness, so they just don't realize it, and it can be activated by COVID. So we do know that either the vaccine or a COVID infection can reactivate an occult Lyme infection. And so we're seeing a major uptick. The CDC is reporting annually, usually about 300,000 cases of Lyme disease in America. Last year, they reported 475,000 new cases. So there was a big uptick. And does that mean more people are being bitten by the ticks during the lockdown? Probably not. We're less likely to be outdoors during the lockdown. We're kind of sequestered in our homes. So why the increase in Lyme? Well, Dr. Barscano, who's one of the founding fathers of ILADS, theorizes that this is what we call reactivation or activation of Lyme from COVID. You know, we see that with Epstein-Barr and a few other viruses. So why not with coronavirus? More research needs to be done to find that out for sure. But we have concerns, and now we have to distinguish: is this COVID, post-COVID syndrome, or is this Lyme activation? So yeah, so if you do have an underlying Lyme situation and you take N-acetylcysteine can do it too, because it's a biofilm disruptor, but Alinea or ivermectin can actually cause herxing. And herxing is referred as a shortcut or short version of Herxheimer reaction. The Herxheimer reaction is a die-off reaction. So if you've got bugs in you, and it could be a pneumonia, you can see herxing with pneumocystis pneumonia or pneumococcal pneumonia. When you give a large dose of, let's say, Rocephin IV, people can have a Herxheimer reaction as those bugs are dying off. They're causing a cytokine storm. And that can cause increased inflammation, which causes symptoms like headache, chills, fever, body aches, nausea, that kind of stuff. So the high doses of Alinea or ivermectin can cause Herxheimer reactions in folks unsuspecting that they have a tick-borne. And it says here, how can you treat a toddler? Probably don't need to treat a toddler. Toddlers and children and adolescents under the age of 16 are you're seeing outliers being reported in the news of little kids in the hospital vents, but that's very, very rare. Kids are really resistant and resilient, and they're not considered high risk. So the FLCCC is not really advocating the use of ivermectin in children yet, although you can do it, and it is based on weight. River blindness occurs in children in Africa, so and in South America. So they would use pediatric doses of ivermectin for children. So it can be used, and it's really a shame that I saw a report on CNN where a talking head was talking to a scientist, and she wouldn't even let him talk. He's the expert. She didn't even let him say 2 words. She was basically reading off the teleprompter, reading some kind of narrative about, well, ivermectin is used for horses. Well, yeah, it's used in vet, but it was used prior to that in humans. A lot of veterinary medicines are also used in humans, and vice versa. So it's nothing new, and they're just trying to make people panic or discourage them from using a therapy that's actually safe and effective because it's not in their narrative. So it's very unfortunate, and it's so unfortunate. I'm just so sad about how medicine has gone in the last couple of years. There was a question about, will the video be available later? Yes, I'm recording this, so it will be available for later viewing. Just look at our Facebook page or our blog, and we'll have it available. Let's see. I see Vincent has joined us. Vincent is a very smart fellow who I've known for a good while, and I'm going to let him come off mute and talk. He knows Alinea like the back of his hand, so I'm letting him make a few comments on that. Vincent?
Sure. Hey, good evening, Dr. Saleeby and everyone. Hey, thank you for having me on tonight. Alinea has been around since the early 90s, predominantly an antiviral, used to treat Cryptosporidium and Giardia. But we're finding that it has excellent antiviral properties. Mount Sinai Hospital in New York City was using it to treat hepatitis before we had these wonderful drugs come out that eradicates hep C. So it really knocks down viral load. They were currently doing some studies for SARS-CoV-2 and also MERS, and the data looked very promising. However, currently we're still, or I should say, Romark is still looking to get the approval from the FDA, emergency use authorization to use Alinea for COVID. We had some recent studies come through. Dr. Saleeby mentioned those just this evening in the Lancet that showed some very favorable results using Alinea. Granted, the dosing is a little bit higher than the standard dose. So Alinea indicated to add 500 milligrams BID, but the dosing that they're using is double that. So it's 500 to 1,000. You could do 1,000 milligrams BID, or you could do 500 milligrams QID, or 4 times a day. Side effect profile is very close to placebo. Again, Dr. Saleeby mentioned you'd get a very deep yellow urine, and yellow urine is not due to any liver toxicity. It's due to the conversion of nitazoxanide to something called tizoxanide glucuronide. Nitazoxanide converts to that product through glucuronidation. It's just a metabolic process that puts Alinea or nitazoxanide into the metabolized form, and that's what actually does its work.
Yeah, that's the if I'm not mistaken. If I'm not mistaken, Vincent, the nitrous oxide is the prodrug, so it has to go through some metabolism to become active, correct?
That is correct. It does. It uses plasma protein to actually convert over from nitazoxanide to tizoxanide. So one of the things that was very favorable with nitazoxanide is that there's few to no drug-drug interactions. So you don't really have to be concerned about other medication that you take and how it's going to affect how Alinea is absorbed in the body. So, but it is a prodrug, absolutely. The actual metabolic form is tizoxanide, not isoxanide. So yes, you're correct. Absolutely.
Thank you. Thank you, Vinny, for sharing with me. I also noticed that there, and now I don't want to put anyone on the hot seat, but I noticed Dr. Suzanne Swearingen is on this video webinar as well. Suzanne, do you would you want to come off of mute and share anything you, as she's an acupuncturist and traditional Chinese medicine practitioner, and that I've known for quite a bit. If you have anything to add, I'd love to hear it.
Well, I haven't seen, well, let me back up. I actually just came off of a conference where we did discuss some things as far as patterns that are associated with conditions like, viral conditions similar to COVID. Obviously, I'm not going to be seeing people with acute cases. I do see a few, and I'm just here recently starting to see some trickle in with long COVID type issues. And interestingly enough, the pattern is very similar to COPD. So, except that COPD is typically resulting of a deficiency, as where this is more of an external invasion is what they would consider in Chinese medicine. So, responding really well to acupuncture. Most cases, though, I do some adjunctive care with either a Chinese herb formula and definitely using the standard process nutraceutical protomorphogen to help what I call fuel the body as we're trying to guide and direct it using acupuncture.
Right. Very good. Thank you. Thank
Yeah.
you for that input. So we are seeing a good bit of post-COVID. We were seeing post-COVID syndromes and post-vaccine syndromes. Some of them are pretty challenging cases. And there is a whole protocol for that. Now, that can go on for some time with therapy to reestablish mitochondrial function and detox pathways. So it's kind of complicated and pretty intense for some. So we are at this point not able to fulfill all inquiries for ivermectin prophylaxis. We just don't have the staff or the providers to address all that. We are taking them, the folks that are acutely ill, those need to come first. We have to keep people out of the hospital. So we're prioritizing those that are sick, that have low SATs, cough, fever, those kind of things, who tested positive, and providing them. If we can't get ivermectin, then we're going with Alinea. Okay, and we are encouraging people. Matter of fact, as a community service, we're giving folks full access to the nutraceutical bundles. Whether you get on ivermectin or Alinea, at least get started as soon as possible on the nutraceuticals, and because that can help save lives. All of last year, I would brag, I didn't have a single person in the hospital with COVID. I had no deaths. This year, unfortunately, I can't say that. I've had 2 patients, both about my age, both men, and actually both of them were also friends of mine, one for almost 30 years, and one was a husband of a realtor that we used in North Carolina. Both of them have been vented for almost a week and a half. One is actually recovering pretty regularly, steadily getting better. They came late to the game. They didn't contact me until they were symptomatic for at least a week. Each of them actually only got 1 dose of ivermectin in them before they had to be admitted to the hospital. And of course, once admitted, the hospital staff took them off of all their nutraceuticals and the ivermectin. It is my firm belief that had they stayed on the ivermectin and ramped it up on the dosing, they would be at home watching television right now instead of being on a ventilator. I had actually encouraged the spouses to go to the ethics committee and get the hospital attorney involved, because it's the patient's right to control their own body, and they can certainly get permission from the pharmacy to administer home medications to the patient It does not harm, and it doesn't go against anything they have done. Both patients received 2 rounds of remdesivir, which did absolutely nothing for their health, except continue to see a decline. So there are things that are part of this archaic protocol that just don't seem to work. And we got to wake up our doctors and those that control hospital policy to allow patients to have a little bit more control of their lives and their health by utilizing things that we know seem to work. Okay, I'm going to have to say that we'll have to end it here. I'm going to try to do another live COVID Q&A maybe in about a week or 2, but this recording will be posted on our Facebook and blog for people. So if you know people that missed this, they can come by and view it in its entirety. I probably have time for just one more question if there's anyone that wants to unmute and ask it, and then we'll have to end.
Dr. Saleeby, I'm sorry to hear about your friends.
Oh, well,
It's
thank you.
Tanya.
Yeah, hi, Tanya. Hey.
Um,
Yeah, I was saddened that they didn't contact me earlier. One fellow, he cannot take supplements at all. He takes a multivitamin. He gets really nauseous and throws up. So he was sort of like behind the 8 ball from day one. But by the time he consulted us and got his ivermectin, I mean, his condition deteriorated to the point where he needed high flow O2, and he was in the hospital with high flow BiPAP O2 for probably a week before he needed to be vented. So his wife texted me today, and he's basically hopefully coming off his vent settings are being turned down. So hopefully he'll be off the vent in the next couple of days. But
Well,
thank you for your concern.
Yeah, well, my question was just about the ivermectin that we do have from the script that we had before, about 5 weeks left for both of us. Should we continue that on a weekly dose or save it?
No, I would continue if you're being exposed or in high risk areas. If not, you may want to lean back on the nutraceuticals and just keep the ivermectin for later. Now, on the August 11th, they changed the protocol from once weekly to twice a week. And of course, we've got people calling the office saying, what should I do? Should I increase the dose? Well, nobody really knows, but the latest research is what they're publishing on the FLCCC website. And to my dismay, they change it maybe too often. So it can confuse clinicians and it can confuse patients. But I think if you're on any dose of ivermectin, whether it's 18 milligrams or whether it's 32, again, higher doses for those that are sick, lower doses for those that are trying to do prevention. But I instructed a patient today to kind of hold what they had in reserve and lean on the nutraceuticals, maybe ramp up the amount of zinc and quercetin that they're taking.
That was my other question. Like, should we double up on that, like Allergy twice a day, like 10,000 of the
I'd say,
60
yeah,
of the zinc?
Yeah, 15 to 30 milligrams of zinc twice a day with 1 or 2 capsules of Allergy. And don't forget, ramp up your D, 10 to 20,000 but make sure you check serum levels.
Yeah.
And then your vitamin C, 1,000 milligrams 3 times a day, or TID.
Okay.
All right. Okay, guys, I've got to
Thank you very much.
You're welcome. Everyone take care, and email us, call us if you need us. Okay.
Thank you.